Nail fungus occurs frequently, 10 to 30% of the world population is affected. From 65 years, even almost every second. Toenail fungus occurs many times more frequently than fingernail fungus. Toenail and fingernail fungus have the same pathogens, therefore toenail fungus can spread to fingernail fungus, just as fingernail fungus can influence toenail fungus. Untreated nail fungus infections can significantly restrict everyday life. The nails can become so thick that they can hardly be cut. Deformations are also possible, so that wearing shoes can become an obstacle. The earlier the nail fungus is detected and treated, the higher the chances of successful healing. Only when the nail has completely grown over the diseased nail, the nail fungus is considered cured. Anyone affected by nail fungus should have a lot of patience for the treatment. In the case of fingernail fungus, healing can take up to 6 months, and 9 to 12 months for toenail fungus. The cause of nail fungus can be an infection of shared towels, as well as beds, carpets, sweaty feet, or communal showers. What are the symptoms of nail fungus? And how do I recognize nail fungus? Depending on the nail fungus, optical changes can be seen. In the early stages, the nails lose their shine and become cloudy. If there is no quick treatment, the nails turn yellow, gray, and blue. Both spots and stripes can form on the nail. The top structure of the nail layer thickens and gradually dissolves. Not infrequently, the subsequent redness and inflammation of the nail bed is very painful. Nails have a protective function, as the nail bed is very sensitive. Therefore, after detection of the disease should immediately begin treatment. Depending on the severity of the infestation, an external application may be sufficient. If the nail growth zones or only a small part of the nail is affected superficially, a special varnish is usually sufficient for external treatment. This antifungal varnish is uncomplicated to apply. A thin layer is sufficient. The varnish should be used until the fungal infection has completely healed. In the further course of treatment, the nail should be filed regularly. This not only rubs off the fungus, but the antifungal varnish can then penetrate better. Attention, only disposable files should be used to avoid transferring the fungus to healthy nails. If independent treatment is not successful, if several nails are affected or if the pathogens have spread to more than half of the nail bed, then the only solution is to go to the doctor. In addition to external application, tablets can also be used. These medications require a prescription. It is essential to inform the doctor in advance about any pre-existing conditions. The tablets can have a negative effect, especially on liver dysfunction. During treatment with tablets, the active ingredient is transported through the bloodstream to the nail bed. The medication should be taken until the nail fungus is completely healed. It is not uncommon for the therapy to be discontinued too early. The pathogen is not yet completely defeated and nail fungus forms again as a result. Nail fungus can be prevented. The following measures should be observed. Do not wear wet or damp shoes or closed shoes in which your feet sweat a lot. If possible, switch to shoes that are permeable to air. It is also recommended to disinfect shoes regularly. Avoid walking barefoot in swimming pools, spas, or saunas. Socks should avoid synthetic materials and prefer wool or cotton blends. Socks and shoes should not be shared with others. Change socks or stockings daily, or even several times a day in case of increased sweating of the feet. Especially people who tend to nail fungus or were already affected, regular professional foot care is mandatory. Also, otherwise a foot care is not to be renounced, and for example after the shower the feet are dried correctly before socks or shoes are put on. Wash towels, comforter cover, sheets, socks, stockings regularly at 60 degrees to avoid giving the pathogens room to spread. A full detergent is sufficient. However, it is possible to use special detergents. For example, you can also switch to hygienic detergents. These are usually used at up to 60 degrees Celsius. So you should be able to get your nail fungus under control quickly. Do you still want to know what happens to you when you go jogging regularly? Then be sure to watch the video which we link to you at this point. If you like the video, then I would be really happy about a thumbs up. And don't forget to subscribe to this channel and activate the bell so you don't miss any new video.